A pathologist was examining tissue samples from 3 different patients. The first patient had suffered a heart attack. The second had tuberculosis. And the third had acute pancreatitis. Surprisingly, all 3 showed cell death. But under the microscope, the dead tissues looked completely different. Why would the same process produce such different appearances? The answer is necrosis. Necrosis is the death of cells or tissues in a living body due to irreversible injury. It is always associated with inflammation and tissue damage. But necrosis doesn't always look the same. Different causes produce different patterns of necrosis. Let's start with the first patient. After a heart attack, blood supply to the heart muscle is lost. The cells die, but the basic tissue architecture is preserved for a few days. This pattern is called coagulative necrosis. It is the most common type of necrosis, and it is typically seen in infarcts of solid organs such as the heart, kidney, and spleen. Now let's look at the second patient. In tuberculosis, the dead tissue becomes soft, friable, and cheese-like in appearance. The normal tissue architecture is completely lost. This pattern is called caseous necrosis. It is classically associated with tuberculosis and certain fungal infections. Finally, the third patient had acute pancreatitis. Pancreatic enzymes leaked into the surrounding fat tissue. These enzymes digested fat cells and released fatty acids. The fatty acids then combined with calcium to form chalky, white deposits. This pattern is called fat necrosis. So remember, coagulative necrosis, seen in infarcts of solid organs. Caseous necrosis, classically seen in tuberculosis. Fat necrosis, commonly seen in acute pancreatitis. But these are not the only types of necrosis. In Part 2, we'll cover liquefactive necrosis, fibrinoid necrosis, and gangrenous necrosis.